Okay, right, so we've got half an hour, which you may get part way through. What I'd like you to do is to work in small groups, so maybe up to 4 people. And I'm going to give you some examples here of study questions that I'd like you to just think through. How might you go about designing a case-only study? And I suggest that you work on either number 1 or number 2. Decide for yourselves. But there are published papers on all of these questions. There's not necessarily one correct way of doing anything, but there are different ways that you might approach them. Okay? But do please work in small groups, because I think you'll benefit from talking to each other. Okay, now I suspect you didn't finish, am I right? But you got some way through, maybe? So which research questions did you look at? So this group here.
Which shows flu infection, myocardial infarction.
Okay, flu and MI. And this group?
The same one.
Same one? And this group?
HPV and GBS.
You did HPV and GBS. Okay, so obviously we don't have very much time, and I'm going to say, so because 2 of you chose the same question, we'll talk about this one. But what I will do, there are published papers using a self-controlled method on each of these questions, and I've sent the papers to Jar, so she'll email you the papers so that you can read what people did. So as I say, there isn't necessarily a right, there'll be lots of wrong ways of doing something, but there isn't necessarily just one right way. So it's just interesting to find out what you did. So amongst your groups then, so which of the 2 controlled or self-controlled methods did you decide to use? Which one did you use?
We chose crossover.
So you chose the case crossover,
Yeah.
and
We too.
you also did case crossover. Okay, so that's good. Why did you choose case crossover and not the self-controlled case series?
It's kind of because the case of myocardial infarction is kind of like it's all complex, so people only case who have experienced the outcome will be considered.
Yeah.
And also each case have 1 or more risk period.
Yeah.
And
But why? So why that method and not the self-controlled case series?
I guess compared to the other one, we don't have a well-defined observation period. Like we don't have a well-defined period of high risk.
I think
I guess flu season will be high risk.
flu season's high risk. Yeah. How about this group? Why did you choose?
Our reason is because the period of exposure is usually limited with flu infection within 1 or 2 weeks. For acute exposure, maybe case crossover is more suitable than case series.
Okay, personally I think that either would work, but I was curious about why you may have chosen one over the other. I don't think, like I say, there isn't a right answer, and I think either method would potentially work. Okay, so how did you define the exposure period?
Flu season.
The flu season, but you want to know on an individual level whether somebody's been exposed to flu. So it could be flu, let's say flu season right now, but I don't have flu. So how are you defining exposure?
We define 2 weeks after flu infection. In Japan, most patients visit to clinical hospital if they are affected to the influenza.
Aha.
They can freely prescribe anti-flu drugs in Japan.
Ah, okay. So this is a really useful feature of your healthcare system, that you could define who's got flu. So this is going to be really important when you're approaching this kind of a question, is to make sure that you'd be able to ascertain or find whether people have got the exposure. So you've got a great example there, the flu you can identify. Okay, so that's a good way of defining it. And then your risk period. So I think did you say 2 weeks, was it?
Yeah, or 1 week. 1 week, 1 or 2 weeks.
So 1 week, and so why did you choose 1 week? So basically you're going to say a week before the MI, did somebody have flu? Is that right?
Yeah.
Okay, so why 1 week?
It's very based on our assumption, like 1 week, that's how long the flu will take.
Okay, so
This is our assumption.
yeah, that's a good thing. So you've thought about it should be a fairly short period, and we're going to go for a week. What did you this group pick?
Depending on my clinical expertise.
Depending on what, sorry?
Clinical experience. 2 weeks seems reasonable.
Okay, so we may vary slightly, week, 2 weeks. What you might want to do is have potentially a sensitivity analysis. So whatever period you choose, we often don't know for sure what that period should be, and so what you might often do is say my primary would be 1 week or 2 weeks, but I may look at a shorter or longer period as a sensitivity analysis, so that would be a useful design feature as well. Okay. What did you think about people who have more than one episode of flu? Could you have more than one episode of flu? How would that work?
It's unusual. Usually, during one season, one patient suffer. Most patients suffer only once.
Yeah, I think so too. What you may find when you do record using or research using electronic health records, you will find impossible people. So you may find people who've got more than one episode of flu in their record. Now, I'm not asking you to find a solution right now, but I'm just telling you this will definitely be a feature of the data that you will find something that should not be possible. So you would then have to decide, if somebody has more than one episode of flu, how do I treat them? Do I throw that person out altogether? Do I treat the first one as flu, the second one as flu, both of them as flu, knowing that they both can't be? So you'd have to have some way, a bit like this morning Masao talked about, the kind of questions that he had to face when he was looking through the data to then progress with the study, and you would need to think what to do about each of those situations. Okay, how did you define the outcome? How would you know whether somebody had the outcome?
Myocardial infarction.
And how would you know that somebody had an MI? Official diagnosis, yeah. So if we were working in electronic health records, then we would potentially have a code list, which hopefully somebody has already validated. Because to do a validation could be a year's work for somebody. It could be a very long process. Okay, so you got your MI, and did you have a different way of defining, or?
Similar way. In Japan and foreign countries, myocardial infarction is already validated with administrative database, and the PV is usually high.
Yeah. Okay. So I think it is an outcome that we would think we're going to know if somebody's had an MI. So that's a good thing. Were there any assumptions about your method that you chose? And one thing that you mentioned to me was something about the flu season. So how did you take that into account in your design?
For each case, we'll observe, for example, like 1 week and then per flu season, and then compare.
So you'd go back over previous flu seasons?
Yes.
Ah, okay. That's one thing that you could do. Yeah. You would then need to account for age.
Yeah, age.
Yeah.
And kind of like, I don't know how. I would assume traveling would be a confounding factor, but I don't know how to
Could be.
like do with that?
Yeah, you maybe couldn't. So I think you would have to assume that travelling was not introducing a big bias, because I don't think you could easily get information on whether or not your cases had been travelling to a different flu season during the periods you're interested in. Yeah. How about you? Any other?
So we also use the only winter season in study field, and one assumption is the temperature is not so severe change.
Uh-huh.
Um,
I don't know if, because obviously there might be different types of virus. I don't know if there can be like official record to show the trends of different viruses across different seasons, different months.
Yeah.
And I don't know if flu shots is a thing here.
If what, sorry?
Flu shots, flu vaccination.
Ah, flu vaccine's a really good point. Yeah. Yeah.
Yeah, I don't know if that's a.
So I think there are some quite big issues with it. So if you're going to compare across different flu seasons, then the previous season, the flu would have been a different strain, maybe less people got flu, there would have been differences. If you're looking within a season, then of course the spread of flu is not going to be static throughout. So I think whichever way you choose, there are things that you would then need to think about to then get what you think is the best design. And then I know that we're out of time. And you've talked about some time varying confounders, you've talked about travel. Were there any others, and also the flu season itself, was there anything else that you thought may change with time?
Temperature, global warming.
Ah, temperature's a good one. Yeah, so we know that temperature, in fact, particularly in the cold season, or actually depends what country you're in, maybe less so in Japan, but in the UK, we find that in the summertime, the risk of myocardial infarction doesn't really change. In the wintertime, when it can be very cold, then the risk of MI goes up. In countries that are hotter, it's the other way around, where if you're going down to maybe 0, -1, that doesn't matter. But if you're going up to 40, then sure, that really matters. So the temperature can matter depending on where you are. Okay, I'm going to stop us there because we're going to have a break. But thank you very much for that. Even though you didn't have long, you came up with some really interesting thoughts. I'm sorry we didn't get to your question, but we will send you the papers for both examples. Okay, thanks very much.